Could you be pregnant? The proof is in the pregnancy test. But even before you miss a period, you might suspect, or hope, that you're pregnant. Know the first signs and symptoms of pregnancy and why they occur. Significant hormonal changes take place during pregnancy. These trigger a variety of symptoms. Some women experience many of the symptoms of pregnancy, while others may have only a few. Classic signs and symptoms of pregnancy. The most common early signs and symptoms of pregnancy might include 1. Missed period. Missing a period is often the first sign of possible pregnancy. However, some women experience light bleeding around the time of their expected period. If you're in your childbearing years and a week or more has passed without the start of an expected menstrual cycle. 2. Nausea and vomiting. Morning sickness is a condition that affects more than half of all pregnant women. The symptoms include nausea and vomiting and loss of appetite. Many women with morning sickness don't just get symptoms in the morning but experience them throughout the whole day. 3. Tender, swollen breasts. Early in pregnancy, hormonal changes might make your breasts sensitive and sore. The discomfort will likely decrease after a few weeks as your body adjusts to hormonal changes. During pregnancy, the breasts become fuller, swollen, and tender. These changes are similar to those you may have noticed in the few days before your period. During pregnancy, the skin around the nipple becomes darker and the veins in the breast become more obvious. 4. Frequent urination. Pregnancy causes an increase in levels of body fluids and greater kidney efficiency. The swelling uterus also presses against the bladder. As a result, most women start experiencing more frequent urination within the first few weeks of becoming pregnant. 5. Fatigue. Overwhelming tiredness is common in early pregnancy. This is most likely caused by the massive increase in the sex hormone progesterone. Progesterone is needed to maintain the pregnancy and help the baby to grow, but it also slows your metabolism. Try to get some more sleep or rest when you can during this early stage. Your energy levels will probably rise again by around the 4th month of pregnancy when the placenta is well established. 6. Food cravings. Cravings for certain foods are very common in pregnancy, especially for foods that provide energy and calcium, such as milk and other dairy products. You may also notice a sudden distaste for foods you previously liked. Some women even develop an unusual taste for non-food items such as soil or paper. This is called pica and may indicate a nutrient deficiency. Please speak to your GP or midwife if this develops. 7. Headaches. Contact your GP or midwife if you have a headache during pregnancy that is not relieved by paracetamol, such as Panadol. Especially in the second half of pregnancy, a persistent headache can be associated with preeclampsia, a condition that can affect your kidneys and thus increase blood pressure and decrease blood flow to your baby.